Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here today with Maynard Nexsen healthcare attorney Matthew Roberts. Matthew, good to be with you.
Good to see you.
And we're excited to have an in-studio guest today. Joining us is Matt Littlejohn. He is the new CEO of the MUSC Health Midlands Division, which encompasses MUSC Health medical centers across Richland, Fairfield, and Kershaw counties, as well as associated medical practices and affiliates. Matt, you're an experienced healthcare leader with an impressive track record of growth. You're also somebody who's from here, who has come home. Tell us a little bit about your journey and how you got back here.
Well, thank you for having me today. It's an honor, but it's also fun to be back in my hometown, working in, being part of Nexsen Pruitt, where I worked all through college. Coming back home to Columbia is obviously the community I was raised in. I grew up behind the VA. My mom and dad moved to Blythewood my freshman year. I went to South Carolina for undergrad. So everywhere I turn, there are memories, but also, I actually fell in love with hospital administration. I didn't know what it was until I was introduced to it through my mom and Matthew. I was able to meet a lot of the sisters who formerly owned Providence Hospital and didn't know what hospital administration was until being introduced to them. So my dad had open heart surgery with Matt Littlejohn at Providence. I've had family members pass away in the ICU at Providence or MUSC downtown. And so this is the community that raised me, but it's also the organization that got me into this and where I fell in love with this job. So it's full circle. Everywhere I look, it's completely full circle, and I'm just happy and proud to be back.
That's wonderful.
Well, welcome home, as we like to say to our fellow Gamecock brethren. Glad you're back in town.
And it's July, so we can talk about it now.
When
it comes September, we won't be talking about it.
Easy to talk about it now. Over the last several years, MUSC has grown, as we talked before, outside of the peninsula in Charleston to places like Florence, Lake City, Lancaster, Chester, and now the Midlands. And they did that a couple of years ago with the acquisition of formerly Providence and then former Kershaw Medical Center. You know this market very well, better than most people. What do you see as your vision and MUSC's vision for the Midlands?
So I think that it's an interesting point in time for the Midlands and MUSC Midlands. The history of these facilities is they've been very committed to the highest quality of care for hearts. And now and that legacy still exists. We're now part of a well-known world-class brand of quality with MUSC. And so I think that, our opportunity right now is to balance ourselves to continue to focus on providing the highest quality and leading the charge around heart and vascular care, but also a lot of the services that, are fundamental to just having a well-rounded healthcare organization. And we have an opportunity to lean on the experience and the traditions and the providers that really set the bar in quality across all different types of service lines, whether that's oncology, orthopedics, ENT, any service line you can think of. We have access to a brand that knows what they're doing and can help us rebalance our organization in the Midlands to be just more to just expand upon what we have with heart and vascular.
This podcast, we started it during the pandemic, like right after the world shut down. And since then, after doing a number of these conversations with Matthew, I keep hearing the word consolidation. All these hospitals are consolidating, yet our state is small. What are your thoughts on hospital consolidation? I mean, good and bad, and can there be more of it in a state our size?
Well, I think that it depends. So our state is relatively small, but we have rural communities and we also have metropolitan communities, which, I think, so when you think about consolidation that MUSC is going through, it's consolidation at a state level. And I think that consolidation in any one particular area could be viewed as a negative thing because it removes competition. Mm-hmm. But rural healthcare is extremely difficult in this day and time. and when you have a brand like MUSC that can bring confidence and stability to a rural community that struggles with that, I think that the consolidation is good when you look at it on the macro scale versus a micro scale of any one particular area. Right. So those are my thoughts on consolidation, and I think that when you have a sustainable, quality organization like MUSC, I think that us, the organization stepping in and being able to provide that stability and confidence to areas that really couldn't survive without it, that's a good thing.
Right.
You have really shot up in the ranks as a healthcare provider, considering that you're young, relatively, and you can really have any job you wanted to. You were in a great job before you came down here. What was it that really connected you to? I know you have the personal relationship, which the former owners of MUSC Health, and you're from here, but there might be easier jobs elsewhere. What were some of the factors that made you say, "Yep, this is for me. This is what I'm going to do"?
Oh, good question, Matthew. So I did leave the most profitable hospital in my experience I've ever worked in.
Right.
And it was much easier, no doubt about it. When you have a good payer mix and a model that works, it can be very comfortable.
And less competition.
Right. Yes. So it can be very comfortable and make life a lot easier. But as we talked about at the beginning, this is my home. And, I can truly say that coming to work every day, I absolutely love coming to work every day. And I love our mission and our brand and who we are. And I believe in our potential, and I think that we absolutely, and a lot of it is very self-fulfilling for me, which quite frankly, I didn't have along that career. Throughout my career, I've been in the Midlands for 2 months, and because of the, community that raised me, really the facility that introduced me to hospital administration, a lot of my own personal memories in the hospital. I believe in it. I want it to succeed more than anything in the world. And, I think that it definitely drives me in a different way than I have been driven in my career.
Well, that's clearly the case in talking to you before you took the job, and since that your commitment to this is evident. But what do you see as some of the key growth areas that you would like to see focused on?
I think boutique hospitals don't exist anymore. And if you think about the legacy of Providence, now MUSC downtown, it's really hung its shingle on heart and vascular.
Right.
And I'm extremely proud of that program. It saved my dad's life. Right. My dad had open heart surgery with Mac Leopard, and as I mentioned in the beginning, and so I'm extremely proud of that. But I think that to be sustainable for the future, we've got to we've got to round out our operation, specifically in surgery, and focusing on the acute. We call it marquee services in MUSC. It's services that are the most acute, highly specialized, and really our goal is to be an extension of Charleston. Okay. For all of the services that make sense. Healthcare. Do we need to have a transplant program? No. Right. Would it be nice for us to grow the VAD program in Midlands? Absolutely, and that can then feed the transplant program in Charleston. Do we want to look at how we can leverage some of the different institutes that they've built in Charleston, and apply those here? I think that there's tremendous opportunity in name recognition and quality programs that we haven't necessarily had as part of our focus in the past.
Right.
As you mentioned, the MUSC brand, well-known, well-respected, and I can see where in a rural community, that brand coming in would instill confidence in people. But I suppose you could also use the brand in recruiting physicians?
Absolutely.
Right?
Absolutely. I mean, it's all about pride. I think that everybody wants to be proud of where they work, whether you're, the housekeeper, whether you're the nurse, whether you're the provider. And I think that that's, and a lot of that is my job, is to, let people feel proud of the work we do and remind and say thank you for that. And so a lot of that is my job every day. But when it comes to recruiting physicians, again, you go back to the confidence they have and the stability that the brand brings. I think it definitely makes it easier to build a medical staff around that. And I think the engagement at our senior leadership level, at the system level, has really helped us. As we talk to physicians, their interactions with, Dr. Cawley, Matt Severance, they've been instrumental in helping us provide physicians confidence that we'll give them what they need, and that we will support them, and that we're in this for the long haul. A lot of times, healthcare is such a tough business that it's very easy to make knee-jerk reactions. And when you have when you're part of a more stable organization, it prevents you from having to go down that road, and you can invest in the long haul. And I think that's a lot of the benefit that that we're going to see in the Midlands with MUSC coming in that they haven't had with some of the previous predecessors.
Sort of like a blue chip stock.
Yeah. It is. Couple of things that you have experience with that I think bring a lot to this job and to the community. You've worked for a very successful for-profit healthcare system, and you worked for a very successful a couple of very successful nonprofit systems. And now you're working for a system that's starts from this academic medical center basis. How do you compare working for a for-profit system with a nonprofit and now a large governmental that has the academic medical center in its roots?
Well, as I mentioned, the stability and the patience to not make knee-jerk reactions is absolutely, and I think and those things are part of what drive confidence in the system that MUSC has.
Right.
That all of those things also help you drive quality, helps you invest in all the right things and bet on the long term. I think what I learned in the for-profits, and I will always be grateful for, is they absolutely know how to make their facilities sustainable financially. Right. And a lot of that revolves around discipline. The for-profits, my experience, the biggest difference that the for-profits have an advantage on is they're extremely well disciplined in how they hold people accountable for what matters.
And allocation of resources and
yes, and they want to be. They expect you to be efficient. They expect good outcomes, and it's not just the financial side. They put tremendous discipline around all of the same stuff. It really comes down to that patience. Is the biggest difference, and patience can sometimes be a good thing and a bad thing. It can be a bad thing when you're you feel like you're trapped and you have to make a drastic decision. But patience is a good thing when it's the right decision and you're prepared to wait it out.
And the for-profits generally have they sort of decide where they're going to be based on payer mix.
Correct.
I mean that's no secret. Whereas the nonprofits and the governmentals are serving a slightly different mission.
Right. I think, the for-profits absolutely know how to make operations sustainable financially. And so I think, I've had the benefit of working in both. And, one thing I've learned is everywhere you go, you try to take the best of what you've learned in that organization and then take it forward, and then try to be self-aware of the things you don't want to carry forward and the things you don't want to do. And they both have those. They both have those on the nonprofit, for-profit side. But on the for-profit side, the thing that I definitely want to take from the last 7 years of being in that environment to here in the Midlands is just the discipline and focus. I started in 2 months ago here in the Midlands, and our leaders all want to know, how are we gonna, what do I need to do?
Right.
And so the two questions that I asked all of our leaders when I met with them is, how do you define success, and what advice do you have for me?
Right.
And, a lot of them, when you ask them, how do you define success? Success looks a lot different in surgery than it does housekeeping or food service. And so you have to take the time to meet with them, and they all want to do well. And everybody that I've met with, the culture is phenomenal. And you have a lot of people who are just yearning for that direction. And I think that's a lot of our job in leadership is, to define what success looks like, build the discipline around that. And people like that. People discipline, people, it sounds harsh, but it really is something that people want. They want to know, what do I need to do? And then I think they like having that focus and knowing this is what I need to do to be successful. And so that's a lot of what we're trying to build right now.
Let me ask you a question about the South Carolina market. We've basically done away with CON. For new hospital services, there's a sunsetting over 3 years, but it's basically done. How does that change the way hospitals act now as opposed to back when we had CON, which was some protection for the existing providers?
Well, I mean, obviously CON has been around a long time, so we're all going to have to figure out what it means, and time will tell. The challenge for large health systems is going to be, obviously, as you mentioned, the for-profits, they go after, the payer mix, right, what makes money, all those things. But when you're accountable for taking care of a population in a community, right, you can't always cherry pick those things. And so I think the only potential risk is going to be, as private equity, for-profit competitors come into the market, independent providers, everybody's going to be looking at, all the cream. Right. They're going to say, what's the cherry picking that could be done here? Right. And it does pose a risk that we're saddled with, the acute tertiary work, which is our core, absolutely. But it does pose a threat to being able to, obviously sustain the operation when you cherry pick out all the best stuff.
Right.
And so I think that's the risk for health systems, not just MUSC, but across the state and across the country. North Carolina just went through CON amendments as well. And so, I think that it's, nothing will be quick and time will tell ultimately. But, for the most part, I think it's obviously what we have to do is just focus on, the core mission that we have and just continue to be excellent at that.
Which will help you be competitive once, the market is open up.
Sure,
Mm-hmm.
yeah.
I might get some of this wrong, but speaking of systems, so
Okay.
MUSC operates the Orangeburg Hospital healthcare system
Yep.
there. You've got MUSC Midlands, that's you,
Mm-hmm.
right? Richland, Fairfield, Kershaw County. Then Lancaster and Chester
Right.
and Charleston. How do they all work together? Like, how does that actually happen?
Well, we're still trying to work through that. I think that we want to obviously function as one. I think that's everybody's ultimate goal is to function as a system, because you can't learn. Obviously, everybody does things well. We talked about you take the best of what you have and you apply it elsewhere. I think, and we try to do that every day. All of our system leadership comes together very frequently, and we talk about best practices. I was in Charleston. I go to Charleston once a month to meet with our system leadership, and obviously they're looking at how do we build consistency across all of MUSC and maintain those high standards for everybody. And then a lot of it is just collaboration. Whenever we talk about programs daily, we do a daily safety huddle across the regions where we talk about any of our challenges that we're having, no matter how great or small they may be.
So you're all comparing notes, whether you're in Lancaster or Columbia
Absolutely.
or Lake City.
Absolutely. And there are a lot of times where, I'll be talking about a problem I have, and and there's just a general culture of, well, why don't you call this person, or that person? And everybody, I think, there's definitely a culture of everybody wants to help each other. And, there are a lot of people who have already figured it out. And it's no different than anything else in life. You don't have to reinvent the wheel.
Right.
So a lot of times you can just learn from somebody else, no matter where they are, whether it's Florence, Lancaster, Charleston, Orangeburg.
They have to be humble enough to say, I've got a problem I can't fix.
Oh, that's easy in healthcare.
Yeah. Well,
All right.
you got to have the culture that encourages too.
Yeah.
That helps.
That definitely helps. But, everybody's got problems. Healthcare is absolutely a zero-sum game when it comes to whether it's your budget, whether it's quality, no matter what it is, it's never enough. And so that's just the nature of the industry, and it's all zero-sum. And, so that makes it easy to, raise your hand and say, hey, I want to learn from you, or, how did you do this? it makes it very easy.
Yeah. Well, Matt Littlejohn, it's great to see you back
Yes.
in Columbia, South Carolina. As the new CEO of MUSC Health Midlands Division, I encourage you to continue to give Matthew Roberts a lot of grief.
Don't worry, he doesn't need any encouragement. For that.
I can handle that. I can handle that.
We'll be cheering you on for your success, though, for sure.
I appreciate that.
For those of you who joined us on today's conversation, we hope you got to know Matt a little bit more and watch his surely good track record here in Columbia. We look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.